LCAMP.
Tony Amadeo, AMADIO, Beaver County Commissioner.
Jack Manning, Beaver County Commissioner, MANNING.
That's good? Good. All right. Good afternoon, everyone. We want to thank you for coming here on such a short notice. We want to extend our thanks to the first responders, the medical staff that are taking care of our residents throughout Western Pennsylvania and Pennsylvania daily. My colleagues and I called for this press conference today to address and answer many questions that have been raised on a local and national level concerning the issues specifically surrounding Brighton Rehabilitation and Wellness Center. Due to Governor Wolf's recommendations in mid-March to limit mass gatherings, the Board of Commissioners decided to close the Brady's Run Ice Arena. On April 1st, 2020, as concerns grew regarding the potential amount of deaths associated with the COVID-19 virus, we decided to keep the chillers on at the ice arena, which in turn maintains the ice, in case Beaver County was to see that increase in our county. The decision to keep the ice frozen was not based on any direct knowledge county officials had, but rather based on the mass casualty and mass fatality response plan that Beaver County has had in place for nearly 30 years after Flight 427 airline crash in 1994. Part of that plan recommends using the ice arena as a temporary morgue if circumstances were warranted. I want to stress at this time, this has only been done for a worst case scenario. On Tuesday, April 14th, the State Emergency Operations Center made our EMS department aware of 3 nursing homes in Beaver County with positive COVID-19 cases and provide the following information. Brighton Rehab and Wellness, 104. Rochester Manor and Villa, 1. Villa St. Joseph, 1. At this time, and after talking to the Pennsylvania Department of Health, they are confirming 2 nursing homes, 70 total cases, 61 residents in those nursing homes, 9 employees with 10 deaths. We have ongoing concerns with the Department of Health and Brighton Rehab's figures and release the information. It is difficult to prepare and answer questions from our citizens and our communities when the information we are getting appears to be inaccurate, delayed, and non-existent coming from these entities. With the discrepancies in the information at this time and the lack of response we've been getting, it makes it difficult for the county to know exactly what we need to prepare for. Beaver County Emergency Services has been proactive in reaching out to representatives of Brighton Rehab, but have not gotten any feedback, if any, little. Today, we ask the management of Brighton Rehab to be transparent, as it is important to the families of those which loved ones are living there, the local medical facilities, and the community at large to understand the situation in their facility. At this time, we are available for any questions.
Do you have reason to believe that Brighton's being transparent with the state? I mean, why is it? I understand why you all need to reach out to them, but can you just talk about what their transparency issues really are? Does the state health department know that they're not reporting according to you in a manner that you think is transparent?
So, at this time, from our knowledge, they are reporting what they need to the state. On how the state PA Department of Health reports that back out to the community and the local officials at large, we can't answer that question. Anytime a nursing home puts a press release out, it says they are presuming all 800 residents and employees to be a positive for COVID-19 and are reacting to that. We understand why they're doing that. They want to take the proper precautions that everyone is treated that way. We have to, on the county level, be prepared to enact any situation we have.
For Brighton Rehab, can you just go over the numbers again for confirmed positive cases and then the number of pending?
So at this time, the State Emergency Operations Center has made our EMS department aware of 104 cases at Brighton Rehab and Wellness. After speaking to the PA Department of Health, they are confirming that there's only 70 cases within 2 nursing homes. So when we talk about the inaccuracy on reporting, that is what we're discussing. That's 2 state agencies reporting 2 different numbers, and we have concerns with that.
So we know that there's 3 nursing homes in the county that have been touched either by staff or by resident with COVID. So does that confirm in your mind that the information Department of Health has is not accurate, given they're only confirming 2 to you?
The information that they're providing to us they're saying is accurate. Whether there's a delay, we believe that is inaccurate, yes, because we have heard from multiple nursing homes in Beaver County that they have positive cases, whether it's a resident or an employee.
So when the board is planning contingencies, is it tending to believe more the numbers it's getting from FEMA at 104 with Brighton Rehab, assuming that is more timely than the information from the Department of Health, given that the board feels that the other information from the Department of Health is not up to date?
Yes, at this time we are preparing for worst case scenarios. It would take a lot of tragic deaths to get to where that scenario will come in place. But right now, the board and our emergency management is preparing for the worst case scenario.
We received a press release today from the coroner's office who said rather explicitly that he and only he should be relied upon as an official death number for the county, but he did not provide any death numbers in that press release. Do you have current death numbers from him countywide to date?
I do not today. As the coroner put in his press release, he is in control of those death numbers. I believe whenever he sees it deemed necessary to inform us and have that emergency plan in place, we will be informed. From my understanding, is he is reporting everything to the state as he gets it. So why the state is not reporting that out to the public is they're going to have to answer that question.
The press release says that he's the one to be relied upon. Where's the coroner right now? I do not see him out here.
This press conference is called on the commissioners, not for the coroner.
So you do not have death numbers, and you've not heard from the coroner what those death numbers are today?
Not today.
I'm sorry to go over this a third time.
That's okay.
I'm terrible at numbers, and I want to make sure I
Absolutely.
understand what you're saying correctly. They're reporting 104, 1 and 1, I think you said.
Yes.
But in actuality, it's 70 across 2, not 106 across 3?
I think it's the reverse.
That what they're reporting to us, PEMA is reporting that there's 104 cases at one nursing home, one at the other, and so 106 total across 3.
That's from PEMA.
That's from PEMA.
Okay.
What the state is reporting as of noon today is there are 70 total cases across 2 nursing homes, 61 residents in those nursing homes, 9 employees, and 10 total deaths.
So PEMA's saying one thing, the state health department is saying a second thing, and you're hearing separate things from the...
And that's our
places
concern.
themselves.
Yeah.
And that's adding to what your frustration is.
That's our frustration, and I think it's important that we're having our own pandemic in Beaver County at one facility. Our calls that we're getting from the citizens across Beaver County and Western Pennsylvania are, why are our numbers so high? Why, they could be higher for what we know, they could be lower, but right now it's because of one facility that we have here in Beaver County that are raising our numbers, and I believe that is including the death toll, not only positive cases.
So you're operating under the assumption right now that 106 number is essentially, I mean, you're saying you're operating under the worst case scenario
Yes.
as it is.
Yes.
But you don't know for sure.
No.
Is there any reassurance that you can provide for the community? I think a lot of people saw the headline about Brady's Run Ice Arena.
Absolutely.
That's a really concerning headline when it's not put into context as we saw today. Are you able to just provide the context to the community so they really understand what we're dealing with?
Absolutely. So, as I said before, Beaver County has a mass fatality and mass casualty plan. It does call for the ice arena to be active as a morgue. Through our Region 13 and our EMS department, we do have the capability of having refrigerator trucks. So that would be a worst case scenario, as I said. That we are not. There's no bodies at the ice arena. It would take a lot to get there, but that's something that the coroner would have to decide. And that would be as if there's no next of kins for individuals who have passed away.
But we're not even close to being...
Not even close.
I mean, right now, we're handling everything. There are no bodies stacking up any place. We're handling everything right now. There are no bodies stacking up anywhere. The coroner's taking care of business. The bodies are being released. We've got the situation under control. Our plan is working. We have several contingencies, as Dan said. Worst case being, if something extraordinary would happen, then Brady's Run comes into play. But that's a 30-year-old plan that's been there since we lost 132 people in a plane accident, in 1994.
Yeah.
Tony remembers that well, how tragic that was. So what people need to understand is we don't have an out of control situation here. As Dan said, most of this, probably 80%, is coming from one facility. Otherwise, we're like all the other surrounding counties of our size in what we're dealing with. And I think emergency management's here. Those guys are doing an exceptional job managing what we have, trying to do that. So people shouldn't panic, shouldn't take that out of context and overreact to that situation. From my standpoint, it's unfortunate that that was made public because I think it put some undue fear in people's mind. Clearly, there's a situation with Brighton Rehab that needs to be corrected. They need to be more transparent, and the state needs to get its act together on giving us numbers that reconcile with what we know is happening.
I would assume it's probably also hard for the leaders here in Beaver County to really predict where we're at with this curve and the possible peak without having those numbers. That's safe, without knowing the accuracy of them. Is that safe to say?
That is safe to say, and I think that's when I go back to Dr. Levine's report today and what was put out at noon, we're starting to see our surrounding counties flatten the curve, and we're starting to see them receive 1 to 2 new cases a day, but we've been seeing double digits each day, and that, as Commissioner Manning said, that's because of one area in our community, and I think it's important that our residents know that.
Do you view the root of these numbers issues? I mean, is it solely an issue with the nursing homes not reporting out, or is there something the state you feel could be doing to somehow kind of coagulate everything and get accurate information to you? Or is them not reporting accurately and openly, does that ruin everything on downstream?
So I can't answer on behalf of the nursing homes. I know the reports from PEMA, the State Emergency Operations Centers, those are reports coming from the nursing homes. So why the Department of Health doesn't have that and isn't reporting that is a question that we have. And I think that's our biggest concern is, where is the hiccup at? Why aren't we getting these numbers, and why aren't we getting them faster? Inaccurate, yes, sir.
Brighton Rehab isn't answering our questions. Are they answering yours?
We haven't had any contact with Brighton Rehab. I can tell you that they've reached out to us now 3 times, the third being today, not reach out to the board, but to our emergency management asking for some supplies. The first 2 were fulfilled by PEMA. They go through the HAP Hospital Association. When you need supplies, you have to go through the county's 911 department. The first 2 were fulfilled. They just reached out for a third one to Director Brewer, and they sent that into PEMA.
Have you asked them for sick and death numbers, or have they answered you?
We have not reached out to them to get accurate numbers as of today. Last week we reached out and had no information. Yes.
They did not respond to you?
No.
Our condolences go out to the families of the deceased. This is touching everyone in our county. I have people, friends that I knew personally that passed away. I mean, we're looking at numbers rather than what our losses are. And our loss is a human loss, and we have to bring that into perspective. I think that's the most important thing. Hopefully that you all understand where we're coming from. As far as the ice arena, I was at the crash site in 1994. I spent the entire night up there. Everything had to be taken to Allegheny County. So after that, and it was handled very well. The coroner at the time did an excellent job. What the people in government realized from Beaver County is we needed a place for a catastrophic event, and that's why that was put into that plan. I mean, we're nowhere near that as it's been established here, but that's the only reason that you've heard about the ice arena.
Tony, can anyone go in there and do oversight on them? The way they've been reporting things, shouldn't there be someone over?
Yeah, just the Department of Health is, and we don't have a Department of Health in Beaver County.
No, we don't.
Because we're a 4th class county. We have to use Harrisburg, and that's what we're using. And we're getting mixed results because of it.
Maybe it's time for somebody to really get after it.
Go get them, Sandy.
Yes.
What's the latest at the cracker plant? Can you talk about operations continuing there, or are you all fine seeing additional 300 workers go back, and is that safe right now?
So I think as a board, our main concern is the safety and well-being of our residents. At this time, Shell has been told they do not need a waiver to continue operating with a limited number of workers. I believe they're starting on Monday to revamp and keep it. They have stated that they're going to follow the CDC guidelines, the new guidelines that Governor Wolf has put in yesterday with his executive order. At this time, there's nothing this board can do to prevent that from happening.
Thank you.
Any other questions?
One final thing, just to clarify. According to them, there's roughly 468 residents in that building. This board today, with any confidence, cannot say how many of them are infected, how many of them died, or whether or not that situation is contained?
Yes, we cannot.
No exact number.
We do not have an exact number. Yes, we can't confirm that.
And that's because they're not answering you, and you're getting two different numbers from two different state agencies.
Yes.
All right, thank you.
And all good?
Thank you, everyone.
Really appreciate it.
Thank you.
Thank you. Stay safe, everyone. Stay safe.